Really, I'm happy to be here with you, with my professors of internal medicine, cardiology, and most probably endocrinology and diabetes. I hope I'll be short in my illustrations, but the second part of my event, it's very important. You have to think about it because it's related to the women and men and genital tract. Bismillahirrahmanirrahim. My talk today about diabetes mellitus and urogenital complication. As we know, all anatomy of urinary system, the most important now to talk about, not about the two kidneys, the two ureters, the urinary bladder and urethra. No, I have to convince about the male genital system and female genital system. And please try to concentrate about the male genital system here. It has a prostate, this is the bladder and this is the prostate. Between the bladder and the prostate, there is the internal urethral sphincter. This is an autonomic sphincter. And between the prostate and the extended urethra, there is the external urethral sphincter. This is a somatic sphincter. Behind the bladder, there is seminal vesicles, and the urethra in men it is very long, about 25 centimeters, and very long caliber, it's about from 2 to 3 millimeters. In the female, we have another important thing in the urethra. The urethra is very short, it ranges from 3 to 4 centimeters in length, and it is about from half centimeters to 7 millimeters in diameter. Why I talk about this? Because in men we have two sphincters controlling the urine. One of them autonomic, like this here, it is present in male and female, between the bladder and the urethra. And another one in the male only, between the prostate and the urethra, and it is a somatic. But thanks God, we have another fan-shaped muscle called the diaphragmatic, pelvic diaphragmatic muscles. This is the second type of sphincter which control urine in females. If we talk about the effect of diabetes mellitus in urinary system, we start with kidneys. Kidneys is the first part to be affected. It could be affected by an infection which occurred and leading to pyelonephritis and pyelonephrosis. This pyelonephritis and pyelonephrosis is recurrent and leading to changing the kidney to echogenic kidney. Echogenic kidney means it starts to be a fibrosed kidney. The grades 1, 2, 3, and lastly it ends in renal failure. The second part is atherosclerosis of renal vessels. Atherosclerosis of the renal vessels is a microvascular complication, but it leads rapidly to aggravate the renal failure. The most important effect of diabetes mellitus in urinary system is the urinary bladder. We saw in females a repeated urinary tract infection with a chronic cystitis in females with diabetes mellitus. But why we see it in females more? Because irritation of nerves of the urinary bladder caused an overactive bladder. This is so in 10 to 1 in females. Overactive bladder leading to uncontrolled, uninhibited urinary bladder contractions leading to escape of urine, or what's called incontinence. In females, it's more than males, 10 to 1. That's why I first, when I talk about the anatomy, I say there is two sphincters in the male. One of them is somatic, which is make a more control to urine than the females, which have only one. Urinary retention is the cell complications occur after overactive bladder. After the severe neuropathy occur and the atherosclerosis of the bladder, which is around the urinary bladder, it ends with complete atomy of the bladder. This leads to over urine retention, and it occurs in men 5 to 1 in females. That's why it occurs urine retention in men. Every 5 men, only 1 female suffering from urine retention. Effect of diabetes on urethra, it's appear more in female also. It's not appear in male, in rarely appear. We saw a repeated urethritis and dysuria during maturation in females, and poor control of urethral sphincters, as we said, because due to neuropathy and atherosclerosis of the sphincters. Effect of diabetes leads on genital system, and this is the part I'd like to be concentrated in it. Before I start, please, every one of my professors and my colleagues, you should ask a female about incontinence if she has a diabetes mellitus, because she is ashamed to talk about this. And only 1 female from 19, she is complaining from incontinence. Every 20 female complaining of incontinence, and it is something worldwide appear now. Only 1, she is complaining to the doctor, and another 19, she didn't talk about it. And it is bothering them very. So, before I talk about the complication or sexual complications in men and female, please ask about incontinence in female and weak erections in males. And this is also a bothering. And all our talks before, I listened to a complication in the cardiac, in the renal, in the peripheral, in the neurovascular, and unfortunately, nobody gave attention to the most important 2 things, which is bothering really the male and female, the weak erections in male and the incontinence in female. In male, we start with male sexual complications, erectile dysfunction, failure to achieve or maintain an erection until ejaculation. This failure of erection is due to 2 things. First of all, the erection is happening due to a gush of blood in the 2 penile arteries and a closing of the sphincters. This happens due to psychologically excitations and the impulse transmitted in the nerves till the penis. If you have neuropathy, and this is occurred in every diabetic patient, and if we have a micro or macro vascular changes, this will lead to a failure to achieve or maintain erection. We have also another thing called venous leakage. The venous leakage is a sphincter between the artery and the veins. These commercial veins started to be widening and lose their sphincteric control, and this leads to failure to erection. 50% of men with diabetes mellitus suffering from erectile dysfunction. As we see, 50% of men with diabetes mellitus already has a psychological problem in his life. It's not something easy to have a problem like erectile dysfunction. If we use phosphodiesterase, or what we call Hamezdana, or what we call Viagra, erectile dysfunction is treated in type 1. 50% of patients with diabetes mellitus could respond if they take anything of phosphodiesterase. But in type 2, 60% of men could respond and give a good response. Now, about last 5 years, we have a tadalafil. Tadalafil is one of the phosphodiesterase, but it can be 2 concentrations, 20 milligram and 5 milligram. 20 milligram could give a very good response with patients with diabetes mellitus to achieve instant erection. But if we use the 5 milligram, which is already present in market since 2 months or 3 months, it will treat 2 causes. Number 1, it will increase the push of blood in the penis, and this leads to good erection, and it treats the benign prostatic hyperplasia, which is one of the most dominant male diseases above 50 years. So, if we use 1 tablet, 5 milligrams from tadalafil, whatever the commercial name you use, it will treat 2 causes of diabetic patient. One of them will improve the microcirculation not only in the penis but also in the whole body. Number 2, increase the power of erection. And 3, benign prostatic hyperplasia. Retrograde ejaculation, one of the not common, but it's occur in most patients above 50 with diabetes mellitus. Most occur in type 1. Type 1, it occurs in 70% of patients with type 1 diabetes mellitus for about 20 years. It's suffering from retrograde ejaculation. What does it mean? It means when the man is ejaculate, the semen not expressed outside, no, it's come back to the bladder. And this lead to delayed fertility. Of course, there is multi things to be done. We could take the semen from the urine and centrifuge it and something like that, but it's not a normal type of delivery. This occurs due to vascular or neuropathy and vascular damage to the sphincter. Effect of diabetes mellitus on prostate. This is also very common to occur. Diabetes mellitus aggravate the symptoms of enlarged prostate, especially irritating symptoms. Already, benign prostatic hyperplasia, all men above 50 years old is suffering from a degree of benign prostatic hyperplasia. It could be just asymptomatic or it reach to a dysuria, frequency, irritating symptoms, urgency, and sometimes nocturnal enuresis, and sometimes incontinence. Presence of diabetes mellitus with a patient with benign prostatic hyperplasia, it aggravates these symptoms and it becomes bothering for the patient. Diabetes mellitus enhance acute prostatitis and increase risk of turning it into chronic prostatitis. Chronic prostatitis already present in about 70% of our males between 20 to 40 years old. Unfortunately, this is a very high ratio of disease to be present in our males between 20 to 40 years, and chronic prostatitis most probably due to sexually transmitted disease or infections or from toilets, from anything. But if it is not treated well, it could transmit it to cancer prostate, and the ratio of cancer prostate in chronic prostatic hyperplasia 200 folds, not 2 folds, 200 folds. This is a very high ratio to be transferred to a cancer prostate. Diabetes mellitus. Fortunately, we found ميزة واحدة diabetes mellitus في البروستات إن البيشنت اللي عندهم diabetes mellitus وما عندهمش chronic prostatitis fortunately it decreased the risk of cancer prostate from 15 to 30. But the patient shouldn't have a chronic prostatitis. Effect of diabetes mellitus on this, as our professor said before, there is a microvascular damage. This microvascular damage, no one talk about microvascular damage to the testis. Microvascular damage to the testis is completely destroying the cells, Sertoli cells and lining cells in the testis, especially in type 1 diabetes mellitus, the patient who have long-run taking insulin and long-run uncontrolled diabetes mellitus. This lead to infertility in most of our suffering from uncontrolled diabetes mellitus type 1. Damage of the nerves, atherosclerosis, and the microcirculation, delayed fertility. Effect of diabetes mellitus on vagina. In the last about 15 years ago, we noticed that most about 90% of females suffering from uncontrolled diabetes mellitus is suffering from 2 important issues. Number 1, vulvovaginal candidiasis and vaginal stress, which lead to soreness and itching. And nobody asks the patient about this, and the patient is ashamed to talk about this in front of her doctors. So there is discrepancy between treatment only the diabetes mellitus or treatment the patient as a whole. You have to treat the patient as a whole. So you have to ask about the female if she has any itching, any swelling, any pain in the vagina or vulvovagina or not. The vascular damage and neuropathy which occur in the vagina also make a severe pain, and the mucosal membrane of the vagina, most probably in 90 to 95% of female above 6 years old, became atrophic due to depletion of the hormonal and uncontrolled diabetes mellitus. Female sexual dysfunction is one of the most important things to be known. Psychological problem affecting the sexual desire and arousal. Vaginal dryness, as you see before, there is a decrease in the vaginal wall, hormones and vascular and microvascular damage. This leads to vaginal dryness. Also, painful intercourse, decreased libido, absent sexual response, incontinence during intercourse. Incontinence during intercourse. This is one of the most important bothering of the female, and yet here not reaching to the arousal. Not only the pain, but also presence of incontinence during intercourse. People at risk, as our professor said, hypertension, hyperlipidemia, overweight, above 40 years old, smokers, lack of physical activity. If we'd like to talk about treatment of urinary and sexual complications, there is a general measures in the form of very strict control of diabetes mellitus, treatment of hypertension, treatment of cholesterol or hyperlipidemia, adjust weight to body mass index, stop smoking, and start physical activity. Specific measures. Please tell your patient if he has any dysuria, any frequency, any signs or symptoms of urinary tract infection, not to go to the pharmacy and ask him to give him the yellow effervescent or فوار اصفر اللي الكل بيروح يجيبه من الصيدليات اول بيحس بحرقان. انا عن نفسي ما اعرفش هو ايه نوعه ايه، لان كل الفوارات صفراء بما فيها الفوار الهضم لونه اصفر. فهو العيان اول ما بيجي له حرقان ينزل الصيدليه يقول انا عايز الفوار الاصفر وانا الحمد لله اتحسنت. بليز لو حصل حاجه زي كده نبه على العيان خصوصا الدايابيتيك بيشنتس ان هو لازم يعمل كالتشر اند سنسيتيفيتي اند ريسيفنج ذا انتيبيوتيك strictly to the culture and sensitivity, not a broad spectrum antibiotic, not just فوار evanescence وخلاص وانا كده خفيت، لان يعني most of our patients suffering from chronic cystitis. If we see a patient with diabetes mellitus uncontrolled, you will find in sonar urinary bladder thickness ranging from 7 to 10 millimeters in that is something result. From 1 to 2 millimeters, it reached 7 to 1 centimeters in thickness. This is very bad. Anticholinergic drugs for overactive bladder. Anticholinergic and antimuscarinics and last decade improved very well. And in the last 5 to 7 years, we have an antimuscarinic and anticholinergic highly specific only to work with the urinary bladder, not all the body. That's why dryness of the mouth, dryness of the cornea, and dizziness, all the previous symptoms the patient was suffering from now is الحمد لله يعني started to stop تماما، وبدات الحاجات الجديده اللي موجوده في السوق انها الحمد لله رغم ان في طبعا variations in prices starting from 50 pounds up to 500 pounds. It gives a very good result and it improves the overactive bladder. في حته هنا مهمه هحاول اقولها لكم بالعربي اسمها كيجل اكسرسايز. كيجل اكسرسايز ده عباره عن ايه؟ احنا معظم الفيميل مع الريبيتنج ديليفري بيحصل لها درجه من درجات السقوط. تمام؟ يا سقوط رحمي، يا سقوط يورينري بلادر، يا سقوط فالفا او فاجينا، اوكي؟ المشكله ان احنا دايما ما بنبصش للموضوع ده خالص. البيشنت عندهم دايابيتس ميليتس وعندهم درجه بسيطه من درجات السقوط، دول احنا ممكن نحسن الانكونتنس اللي بيجي لهم بطريقه بسيطه جدا اسمها كيجل اكسرسايز. دي حاجه بره على مستوى اوروبا بتجيب من 80 ل 85% ريزلت كامبروفمنت. هنا في مصر احنا طبعا جربناها هنا بتوع الوطن العربي بدرجه عاليه جدا، الحمد لله ما بتجيبش اكتر من 10% لان محدش بيستجيب للتعليمات خالص. هي بسيطه جدا. بنقول للعيان لو سمحت الصبح 10 دقايق والظهر 10 دقايق وبالليل 10 دقايق وانت قاعد بتتفرج على التلفزيون بتشتغل اي شغلانه بتعمل كونتراكشنز للانال ماسلز كانك بتمنع بريفنت اوف جازز. كان واحد بيمنع بريفنشن ان هو يبص جازز. بيعمل كونتراكشنز اند ريلاكسيشن كونتراكشن اند ريلاكسيشن فور 10 minutes at the morning 10 minutes afternoon and 10 minutes at night. لو مشي على الكلام دوت من 3 إلى 6 أشهر بيجيب ريزلت دراماتيك. وكل العالم دلوقتي بيحاول يبطل الاقراص ويبطل العمليات والسلينج والفالف والكلام ده كله خصوصا في الفيميلز دايابيتكس لان بيحصل ريكارنس وبيحصل السريشن ليهم لما بنركب لهم تاب او شريط عشان نعمل نتحكم في الانكونتنس. فاحنا لو علمنا البيشنتس دول ازاي ان هم يعملوا كده الاكسرسايز، واحنا كلنا عندنا بيشنتس عندهم دايابيتس ميليتس والموست بروجرام عندهم انكونتنس، يبقى كده استفدنا جامد جدا. الالفا بلوكرز اللي احنا بنستعملها دلوقتي بقت برضك هاي سلكتيف، بقت الفا 1 اي والفا 1 اي جي، بقت حاجه جميله جدا انها بقت سلكتيف على البروستيت، دي بتحسن البناين بروستاتيك هايبربليزيا، فبتقلل الاريتيتيف سيمبتومز اللي موجوده مع الدايابيتيك بيشنت. الاميبرامين دراكس بيعالج الريتروجريد ايجاكوليشن وبيساعدنا في حالات المنتورين انيوريسيس. انا برضك ما اتكلمش عن الاطفال تايب 1 بيجي لهم بنسبه عاليه جدا منتورين انيوريسيس، النسبه دي وصلت حاليا قد تتعدى من 32 ل 37% من الاطفال اللي عندهم تايب 1 دايابيتس عندهم منتورين انيوريسيس، وذيس از سامثينج فيري بازل. الاميبرامين دواء بيعالج التورين انيوريسيس مع طبعا بعض العلاجات اخرى، وبيعالج عندنا ريتروجريد ايجاكوليشنز برضك في البيشنتس اللي هم للاسف جات لهم ريتروجريد ايجاكوليشن نتيجه ان هم عندهم كنترول دايابيتس فور لونج تايم. الفوسفورايستريز وات ايفر فوسفورايستريز ده اذا كان سيدنافيل، تادينافيل، فالدنافيل، كل المركبات اللي نازله جديد في السوق زي ما اتكلمت عنها قبل كده بيتعالج في علاج الاثيروسكلروز اللي بتعمل فاسولاريتيشن، بس طبعا في اللونج ران عشان كده نستعملها بجرعه قليله وتكون لونج اكتنج زي المركبات التادينافيل 5 مللي، فدي بتعالج الاثيروسكلروز بالذات في المايكرو سيركوليشن، ودي حاجه جديده ونازله جديد اخر سنتين ثلاثه بيتكلموا عنها جامد قوي، وبتقلل بتعالج علاج الديكريز الفيتامين بي 12 فور دايابيتيك نيوروباثي. بعض اساتذتنا سمعنا قبل كده منهم انه قال لك لا ما بيجيبش نتيجه، انا عن نفسي بكتبها بصفه عامه يعني بتحسن شويه. قبل ما اقول لكم شكرا دقيقه واحده، تيك هوم مسج، اي بيشنت دايابيتيك فيميل تتسال على الكونفدنس بليز عشان خاطري، لان ده حاجه قدرنج للفيميل. اي ميل بيشنت above 50 years old يتسال على الريكتايل ديسفانكشن ولو بصوره غير مباشره، على العلاقه الزوجيه، في اي مشاكل بتواجهك، السكر مأثر عليك من اي ناحيه، الكلام ده يا جماعه مهم جدا وبيعمل مشاكل كتيره قوي 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 قوي. Thank you, I hope you enjoy.